Rhinoplasty in Turkey. How is the nose altered? What do surgeons do? And what makes this procedure worthwhile here? Today, we're going to talk about what is rhinoplasty and how rhinoplasty is done. We'll visit a Turkish plastic surgery clinic and meet a doctor treating foreign patients in Antalya, Turkey. Healthy Turkey always produces informative videos about medicine, so subscribe to our channel on medicine and treatment in Turkey and comment with questions below. As Michelangelo once said, hew away all the odd from the nose to create a masterpiece. Plastic surgeons have perfected this principle and now craft ideal noses, elegant, sculpted, as if made of marble. A sculpted nose and relaxation. That's what a trip for rhinoplasty in Turkey offers. The perfect climate and sea air promote the best healing, and Turkey's healthcare system's peculiarities make plastic surgery more affordable and accessible than in other countries. No need to feel shy here. Let your nose heal far away from prying eyes, and let doctors watch over it. You should just pick really good doctors. We know some, doctors with 10, 15, 20 years of experience, in good clinics, in various cities. There are many surgical methods. We are not tied to one technique. The method is chosen based on the patient's characteristics and the surgeon's preferences. Dr. Ugurcan Şener is a plastic surgeon in Antalya. He completed his studies at Ordu Science School and Gazi University Medical Faculty, completed his specialization at a teaching hospital in Ankara, worked in the provinces and during his service, gaining good experience in aesthetic and reconstructive surgery. He is a member of some professional associations, married and likes sports and good literature. Rhinoplasty has become a very popular procedure and should not be viewed solely as an aesthetic surgery. This is a surgery that patients take seriously, as it not only corrects the shape of the nose, but also significantly improves breathing. How many rhinoplasty techniques exist, and what influences their selection for patients? There are various types of rhinoplasty. They can all be divided into open and closed methods. The main difference is whether or not the incision will be visible at the tip of the nose. An incision at the nose tip means it's an open technique. If there's no incision, it's closed rhinoplasty. In both open and closed techniques, the surgeon decides how the operation will proceed and which layer he will work through. Patient characteristics are very important. For example, the patient's skin may be thin or, conversely, thick. Or perhaps it's rhinoplasty for a patient with dark skin. These and other aspects influence the surgeon. Many surgical techniques are available. We don't stick to one method. The choice is based on the patient and surgeon's preferences. How is rhinoplasty done exactly? What does the surgeon do? Where do you perform it? I prefer open rhinoplasty method. This method allows me to see the entire nose with all its parts and correct everything very conveniently. With this method, the surgeon can correct each part of the nose, especially if there are any shape issues. The surgeon can completely correct everything, and not only that. When a patient comes to us with breathing problems, we also do everything necessary. After all, we doctors have received top-level training for such kinds of operations. I conduct surgeries with the open rhinoplasty technique. This procedure takes around 2 to 3 hours. A person has a small pouch under the nose. It's called the columella, the divider between the nostrils. We start the surgery at this part of the nose. If there's excess in this area of the nose, we remove the surplus tissue. If there is excess on the sides of the nose, we narrow it. And if the nostrils are too wide, we can also make them smaller. We watch to keep everything as it is after surgery. This part is vital. Rhinoplasty isn't just about removing excess. Sometimes patients have very small and disproportionate noses. If we deal with such a case, we open the upper or side sections of the nose lacking volume, and we can place transplants there, which we prepared ahead of time. This way, we achieve the correct shape of the nose, and the patient finds it easier to breathe. In rhinoplasty, the key focus for us doctors is the tip of the nose. For the nose tip, we have different methods for how to place perfect stitches. This way we can give it different shapes and achieve the height of the nose tip that the patient desires. We strive to ensure that the resulting nose shape remains stable in the long perspective. We provide the necessary tissue strength for this. If the nose tip has indeed dropped, it might be because the stitches have separated or there was an injury in that area. Then a follow-up surgery will be necessary and everything can be corrected. The hospital's equipment is vital for plastic surgery. The clinic's equipment and the qualifications of the staff influence both the procedure's quality and the risk of future complications. Thus, you should carefully choose your surgeon and hospital. We talked about the consequences of neglecting this in one of our videos linked here. So, please watch it and be careful. To prevent problems, I highly recommend consulting specialists who understand the Turkish healthcare system well.
After a person submits a request for treatment in Turkey, we, the coordinating doctors of Healthy Turkey, select the best clinic and doctor for them based on their diagnosis, wishes, and needs. As practicing Turkish doctors, we know exactly how to do this as correctly, quickly, and effectively as possible. We constantly accompany the patient throughout the whole trip, and we always stay in touch for any questions that may arise even after the patient returns home. We also talk a lot about our work on our Instagram account. You can subscribe to our Instagram via the link or QR code to get to know us better and, of course, to understand how our company works in general.
What are the contraindications for rhinoplasty? There are no clear contraindications for the rhinoplastic surgery. However, post-surgery, the patient needs to guard their nose against injuries for some time. A patient should be cautious when wearing glasses and masks. If a patient is unable to protect their nose for reasons related to their work, or if they experience any sort of injury or physical assault, then they need to consider carefully if rhinoplasty is the right choice. Furthermore, in cases where patients are not mentally ready for these alterations, we recommend avoiding rhinoplasty. How long does post-operative rehabilitation take, and why is it better to undergo it here in Turkey? After the surgery, we hold patients in the hospital for one night. This is important, especially for pain control. After the surgery, we place a tampon inside the nose and apply a splint on the outside. We take out the tampon in 3 to 5 days, and the splint is removed in 7 to 10 days. It's vital to have this process done here in Turkey, because every surgeon desires the ability to personally manage the outcome of their surgical procedures. It is crucial to provide instructions to the patient regarding nasal cleansing after the removal of the tampon and emphasize important cleansing areas. We recommend different massage methods to patients after the splint is taken off. During the operation, there may be instances where grafts or patches are inserted, and in some cases, they might need to be molded or shaped accordingly. It's crucial for the surgeon to demonstrate the applied splint to the patient during a personal visit to ensure the nose can be shaped properly later. This is why it's important to spend the first week of the rehab process together. How long does the effect of successful rhinoplasty last? Typically, to achieve lasting effects, we perform rhinoplasty on patients from the age of 17 or 18 when the face has fully developed. If the patient is not subjected to serious injuries or facial surgeries after the surgery, the results will be enduring. However, changes in soft tissues and cartilage inevitably occur with aging, so the shape might change a little. But these changes are not severe enough to need a repeat procedure. It is unlikely that repetitions would be necessary. If there are no problems, we perform the rhinoplasty surgery once and ensure a lifetime effect. Turkey offers a unique, comprehensive approach to patient care. In other countries, each procedure often incurs a separate fee. Healthy Turkey Company manages the organization of these trips based on all-inclusive principle, working exclusively with trusted specialists in both medicine and in the hospitality sector, coordinating all their work for each patient. Healthy Turkey handles everything, from consultations and arrangements with the clinic and doctor, to transfers, lodging, migration formalities, and translating medical records.
You can see the company's website address on your screen.
This website allows you to consult and find information about other quality medical services in Turkey. Week by week, we are talking about treating various diseases and serving medical tourists in this country. Subscribe to our channel and stay updated with new videos. We would love your likes as well.